We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for healthcare reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to answer some of these questions about healthcare coverage, we searched for health plans available in Connecticut on Access Health Connecticut, the state's health insurance exchange. We selected New Haven County and identified ourselves as a 52-year-old person looking for coverage. We just looked for coverage for one person and added an income level of $51,000 a year. That income level meant we didn't qualify for a subsidy and could view the full premium costs of health plans. 38 health plans are available from 4 different insurers. We narrowed the search to just silver plans, since those have been the most popular with consumers. There are 11 silver plans available. Under each plan is an option to check if your doctor is in network, which is easy to find for consumers and a handy link. We tried the link for the lowest premium silver plan. It sent us to an external website. The site has a search engine that allows us to search by type of provider and provides a drop-down menu to search for specialty providers. The search engine is easy to use. Going back to our main search, we looked for doctors for the lowest premium silver plan from a different insurer. Again, we found a direct link to search for providers. The link took us to a new web page with a search engine that allows the consumer to type in the name of a provider or to select Advanced Search. The Advanced Search option allowed us to search by provider type and specialty using a drop-down menu that also works very well. We went back to our list of silver plans to find a list of covered medicines for each plan. For the first plan, there is not a link to a list of covered medicines available up front. There are 2 different options to find more information about the health plan. The first and most obvious is to click on the link to Plan Documents. That opens a lengthy document which contains details about coverage, including co-payments and other costs for the consumers. But a consumer has to dig through a number of pages to find information about covered medicines. The other option, which is less obvious, is to click on the small Details button by the health plan name. Scrolling down that page reveals a link to search prescription drugs, right after the information about the consumer's share of the cost for prescription medicines. Following the link to search prescription drugs takes us to a different company's website that the insurer uses a different company to manage the drug benefits for this plan. There are 2 different formulary options. It's not clear which list is the right one for the plan we are researching, so we tried both. We read the descriptions to see which seemed to apply to us. Our situation seems to match more closely with the Essential Health Benefit formulary, so we selected that option. Continuing on led to a page with links to some commonly used medicines and a search engine where a consumer can type in the name of a medicine. To view the entire formulary and to see options for different medicines for a certain condition, a consumer has to look under the formulary list at the top of the page. That link opens 3 different options. We again selected the Essentials list. That opens a file with a table of contents up front, organized by therapeutic classes. These terms are not consumer friendly. A consumer needs to look under anti-neoplastics, for example, for cancer medicines, and then has to look at technical subcategories under that. Also, anti-hyperlipidemics are where a consumer needs to look to find cholesterol-lowering medicines. The list notes the tier for each medicine that relates to what consumers pay out of pocket. For the exact information about what a consumer pays, however, the consumer has to go back to the exchange website and look for that benefit information. We went back and looked for a list of covered medicines for the next least expensive premium plan from another insurer. Again, there was a plan documents link, but we found the details button to be the quickest route to the information. We followed that link and then followed the prescription drug search link to an external website with a searchable drug list. The web page allows the consumer to type in a medicine's name or click on a therapeutic category to see all the medicines listed for that condition. Again, the therapeutic categories used are not consumer friendly. The site relies again on anti-neoplastics for cancer medicines. Endocrine medications is where consumers have to look to find commonly used diabetes medicines. This list also provides information about the tier level of each medicine, which again relates to the out-of-pocket cost for the consumer. To interpret the tier levels, a consumer has to go back to the exchange website, find the health plan, and look under details for what the tier levels mean in terms of out-of-pocket costs for the consumer. Finding the links on the exchange website to search for prescription medicines took some effort, and the information the plans provided on covered medicines was not presented in terms that are consumer friendly. These issues make it very difficult for consumers to find the information they need to select a health plan that works best for them.